Good afternoon, bonjour. I'm here this afternoon to provide an update on COVID-19, the novel coronavirus here in New Brunswick. Today's update will touch on the importance of social distancing, so that's keeping a distance of 6 feet or 2 meters apart from one another, 811, and presumptive testing. The health and safety of New Brunswickers is our top priority, and everyone has a role to play in mitigating the impact of COVID-19. It takes more than governments and action from the health sector to protect the health and safety of New Brunswickers. Social distancing measures are a way to minimize COVID-19 transmission in the community. This means minimizing close contact with others during the peak of an outbreak. Mise à jour d'aujourd'hui porterait sur l'importance de la distanciation sociale, 811, et les tests de cas présumés. La santé et la sécurité de la population du Nouveau-Brunswick sont notre priorité absolue. Nous avons tous un rôle à jouer afin d'atténuer l'impact de la COVID-19. Les gouvernements et les mesures prises par le secteur de la santé ne suffisent pas à protéger la santé et la sécurité des Canadiens. Les mesures de distanciation sociale sont un moyen de réduire au minimum la transmission de la COVID-19 dans les collectivités. Cela signifie qu'il faut réduire les contacts étroits avec les autres personnes au plus fort de l'épidémie. In addition to staying home when ill and staying home after you've traveled outside the country, New Brunswickers should plan to take actions they can take to reduce the spread of infection in places where people gather. So I've already mentioned yesterday or 2 days ago about mass gatherings and how they can have a potential for serious public health consequences if they are not planned and managed carefully. They can increase the spread of infectious diseases and cause additional strain on the healthcare system when held during outbreaks. Telecare 811 is experiencing more than higher normal call volumes. Individuals who may potentially have symptoms are having difficulty getting through to 811. So it's really, really important to remember to only call 811 if you have symptoms. And if you don't have symptoms and you still need information, please go to the GNB coronavirus website. So it's www.gnb.ca/coronavirus for more information on how to self-monitor. The regional health authorities are adding stand-up community assessment centers across New Brunswick. In order to minimize the risk of transmission of COVID-19, access to a community assessment center will be by appointment only, following appropriate triage through Telecare 811. So again, this is for people who are experiencing symptoms. So that is why, please don't call 811 if you don't have symptoms. This afternoon, I'm here to announce 4 presumptive cases. All these cases are connected to the first travel-related case. So I know this can be very disconcerting and very stressful to hear, but I'm not surprised by this, and I expect that there will be more travel-related cases that result in a cluster of very close contacts or household members. So the cases are as follows. Male between 50 and 60 years of age, a female between 50 and 60 years of age, a male between 20 and 30 years of age, and a male between 20 and 30 years of age. So we're breaking down in gender and an age group. And the diagnostic testing confirmed the cases as presumptive. Additional testing to confirm the cases as a positive COVID-19 case will take place at the National Microbiology Laboratory in Winnipeg. So that is the same procedure for all the testing. We do all the testing at the George Dumont Hospital. We will announce the presumptive cases, and then those tests will go to NML for confirmatory testing. But when we announce a presumptive case, we're very, very confident that it will be confirmed. So active contact tracing is being conducted by regional public health officials. Les autorités régionales de la santé sont en train d'ajouter des centres d'évaluation communautaire temporaires à travers le Nouveau-Brunswick. Afin de réduire au minimum le risque de transmission de la COVID-19, l'accès à un centre d'évaluation communautaire se fera sur rendez-vous seulement après un triage en bonne et due forme par télésoin 811. Voilà pourquoi il est important de ne pas appeler télésoin 811 si vous n'avez pas de symptômes. Cet après-midi, je suis ici pour annoncer 4 nouveaux cas présumés. Tous ces cas sont liés au premier cas. Les cas sont les suivants. Un homme entre 50 et 60, une femme entre 50 et 60, un homme entre 20 et 30 ans et un homme entre 20 et 30 ans. Et ça, ce n'est pas une surprise donnant les informations qu'on a sur les cas aux différentes provinces au Canada où on voit un cas lié au voyage et des contacts proches qui sont identifiés après ça à avoir le COVID-19. Alors ça, ce n'est pas une surprise. Je crois qu'on va voir plusieurs cas liés des voyages. Alors, c'est ça ce qui arrive dans les autres provinces du Canada. Alors, c'est ça que je crois qu'on va voir ici au Nouveau-Brunswick. Ça serait un cas lié au voyage et des très, très, très proches contacts avec ce cas-là. Les tests diagnostiques ont confirmé qu'il s'agit de cas présumés. D'autres tests seront menés au Laboratoire national de microbiologie à Winnipeg pour confirmer que ces cas sont bel et bien le COVID-19. Alors, comme j'ai dit en anglais, ça veut dire que tous les échantillons, tous les tests qu'on a dans la province vont aller au Georges Dumont pour le test. Et après ça, ça va être confirmé au laboratoire à Winnipeg. Mais quand j'annonce un cas présumé, ça veut dire que le résultat était positif au Georges Dumont. Les représentants régionaux de la santé publique font une recherche active des contacts. Regular hand washing, coughing or sneezing into your elbow sleeve, disposing of tissues appropriately, avoiding contact with sick people, and staying home when sick are important ways to prevent the spread of respiratory illness. If you are feeling sick, it is particularly important that you not visit loved ones in hospitals or long-term care facilities, as people in these locations are at the highest risk of complication from influenza and other respiratory viruses.
Good afternoon. Bonjour. It's important to realize that today's announcement was not unexpected, that we would see, and we will see additional cases. We knew that our positive or presumptive cases of COVID-19 would rise. There has been over 200 tests conducted in New Brunswick at this point, and we have only 5 presumptive cases and 1 confirmed. It is important to note that when we look at other countries, that we see the experience that had the experience prior to us, that most of the individuals at risk are over the age of 70. It's important to know that we've seen the trends, and certainly the trend in China, that it peaked and is now starting to subside, and the number of new cases have dropped dramatically. So that's encouraging in the sense that the wave has gone through, and we are now just moving into that. We need to walk the line between preparing for this and overreacting. Il faut trouver un équilibre entre la préparation et la réaction excessive. All of the cases we now have were close contacts of the first case. This has not spread through the community, and that is significant in terms of risk to the public. This means that the risk to you and your family is still relatively low, and that the majority of people who get this will certainly fully recover. The group who is the most vulnerable is our elderly, and that is why we're taking precautions we have in our province to protect them by slowing and limiting the spread of this virus as best we can. Le groupe le plus vulnérable est celui des personnes âgées. C'est pourquoi nous prenons les précautions mises en place dans notre province pour les protéger en ralentissant et en limitant la propagation du virus du mieux que nous le pouvons. We need your help to do this. A reminder of the precautions that are in place to date. Schools are closed for 2 weeks. The timeline for the closures will be assessed regularly. We recommend all social gatherings be limited. Please use common sense. For example, nursing homes, we're asking that if you're not feeling well, that you do not visit. But certainly, if you can avoid visiting at all, that would be possibly the appropriate thing to do. Anyone who has traveled out of the country must self-isolate for 14 days. In government, we have suspended all work-related travel. I spoke with Deputy Prime Minister Chrystia Freeland yesterday about closing the border to international travelers, as it has begun and they are doing in the United States. I feel it's important that we recognize the activities in our neighboring border, our neighboring country, and that we implement similar precautions for travelers coming into our country. As a province that shares a border and in many ways is integrated with the United States, we need to be in sync. Otherwise, there could be unintended consequences for our businesses and our economy. Finally, I want to talk about what you as a citizen can do to help. You each play a key role, and if we work together, that role is extremely significant. I cannot stress this enough. Je veux vous parler de ce que vous, en tant que citoyens et citoyennes, pouvez faire pour aider. Vous avez tous et toutes un rôle à jouer et si nous travaillons ensemble, ce rôle sera important. Je ne le dirai jamais assez. We need the people of this province to take these steps, as outlined by Dr. Russsell, in terms of precautionary measures, coughing into your arm and frequently washing your hands, and practice social distancing. Put space between yourself and others. It sounds so simple, but these small measures truly can make a difference. I've said it that in the last couple weeks, I've really learned how to wash my hands after all this time. So it takes a few extra minutes, but you feel better doing it. You feel like that's something that you control and you're doing your part. If you have the symptoms of COVID-19, including high fever, a dry cough, and difficulty breathing, please isolate yourself from others and call 811. You will be walked through the next steps you need to take. And speaking of 811, we are currently experiencing 4 times the normal call volume. And this is not 4 times the actual number of people that are experiencing symptoms. These are people that are anxious for good reason about what should I do. On our website, there's information about what you should do. We need people to slow down and think about how they impact others if they're tying up an emergency service when they do have symptoms. So we normally would have 200 to 250 calls a day. We're experiencing 800 to 1,000. So if you're calling 811 and you can't get through, it's because we're tremendously overloading the system. Let's think about the need for the call. Let's have people that need to be treated or need to be tested have access to our system. We can control the ability of our healthcare system to meet the challenges of this virus. But if we don't take our own consideration and say, do I need to call or can I get my information of just what I need to do in a different location? Let's ensure our healthcare services are there so every citizen have access when they need it. There's also a federal line that you can call, and it is 1-833-784-4397. On another point, while I understand the need to prepare, excessive buying of groceries and toilet paper is not only unnecessary, it is feeding into the fear, and for some, it is actually causing anxiety. We have been talking with the major grocers and the supply chains. They say we are not in any risk of running out of our supply chain. We are running out of specific items, and that could be like a 24 or 36-hour delay. And the reason for that is for panic buying. It's people running in with their half done and filling it up. There is not a need to do this. We are creating our own panic when we do that. Again, think about your needs. Think about others who actually need to live their lives, do it in an ordinary way, but if they have symptoms, have access to the care we need. I am absolutely convinced we can meet this challenge, and we can meet it equally or better than anywhere else in the world. But we do it by exercising a rational thought process, being cognizant of our neighbors in the community, and exercising just a normal everyday activity with the precautions that Dr. Russsell and others have outlined to avoid excessive contamination. Following normal practices and buying what we need with confidence that the necessities will continue to be available on an ongoing basis is the reality. It will be available. It's only a problem if we make it one. Les gens devront acheter ce dont ils ont besoin, comme ils le font habituellement. Et ayons confiance que les produits essentiels continueront d'être disponibles et performants. People need to pause and ask themselves, am I being part of the problem, or am I going to be part of the solution? I know at heart New Brunswickers want the best for their families and for their communities. It's by working together that we will get this behind us, and we will learn from it, but we will minimize the risk to our citizens. And no one comes together better than we in New Brunswick. This is a health concern, but we've seen other emergencies, be it the ice storm, be it floods, where we have come together to help each other. This is another time where we need to come together to help each other. Je sais qu'en fond, les New-Brunswickois et les New-Brunswickoises veulent ce qu'il y a de mieux pour leur famille et leur collectivité. C'est en travaillant ensemble que nous transférons cette improve. Et personne et seule raison mieux que les New-Brunswickois et les New-Brunswickoises face un défi. As we conclude, I want to thank not only our Chief Medical Health Officer and her team, but also the entire team at our Department of Health and Emergency Services who have been working overtime to ensure we're addressing this virus as it impacts and its impacts on our province. We have a tremendous team of civil servants that are working tirelessly to minimize the impact on our province and our people. And I'm proud of each and every one of them. We can do this. Thank you. Merci.
Mr. Premier, you said you spoke with Deputy Prime Minister Freeland yesterday. How did that conversation go? Does it sound like the borders may be closed?
What she assured me is that they're working very closely with the U.S. In fact, the Prime Minister's had a couple discussions this week directly with President Trump. And so there's no plans to, have an impact from the U.S. side on the Canadian border. I mean, we obviously, Dr. Russsell will continue to evaluate that from our side. Internationally, the concern that I was expressing are concerns that we're getting about the U.S. closing international borders outside of Canada and us not doing that because we think it's important that we be in sync. And in that way, we're kind of looking at a North American bubble, if you will, but it allows the supply chain of goods north and south to continue because we have to find ways to protect that because that's important to not only our economy, but it's important to our supply of goods and services.
Harry? Yes, so with 4 more cases and connected to one of the other previously confirmed, are you concerned about community transmission?
I feel like community transmission will happen eventually, but that's not where we are right now. I do expect that any other cases that I'm going to be announcing in the days and weeks to come early on would be directly related to a travel case.
So the people who, I guess, are confirmed or currently self-isolating, are they following protocol for public health if more people are still kind of getting this?
My understanding is every close contact that has been contacted by public health is following their advice, and public health is following up with them every day.
Are there any measures just to make sure that they are self-isolating? Are they going outside at all?
My understanding is they are following the public health advice.
Quebec just announced that they're getting ready to close ski resorts, libraries, swimming pools, in short, all gathering places. Will New Brunswick do something similar?
I guess this could be a question for Dr. Russsell, but I'm sure that Dr. Russsell and her team are evaluating all the activities outside of our province and looking at the sensitivity and urgency here in New Brunswick, and I'll be looking for guidance in that regard and working with herself and the health team to make that decision.
So it's not on the table right now?
We're having discussions about all the different steps that we need to take to protect New Brunswickers' health right now, so those are definitely on the table.
What about daycare centers at this point? They stay open?
As of right now, that's the direction, but again, as things evolve, we're continuing to have discussions and reevaluating all of the steps along the way.
I think it's important to, leave this discussion and in any discussion as we go forward that this is a rapidly changing environment. And so every area of additional exposure will be evaluated as to its risk level at the time, and I'm confident the appropriate decisions made to deal with it. So we can never take any activity or changes off the table.
Est-ce que c'est possible de le répéter en français, s'il vous plaît, votre réponse?
La réponse pour la question si les bibliothèques et des choses comme ça.
Ouais, les lieux publics, puis les écoles, les garderies, les centres de la petite enfance.
Alors, fur et à mesure que l'information qu'on reçoit change, on va toujours évaluer les décisions, fur et à mesure qu'on a des nouvelles informations.
Savannah?
As of right now, are people being screened for symptoms and travel history upon entry at New Brunswick airports?
Well, again, most of the international, the work between Public Health Agency of Canada, that's federal in terms of how people come in and out of the country. So all that messaging would be with Canadian Border Services Agency.
So, Canadian Border Services Agency, there are no New Brunswick airports on the list. So, outside of that, there are no measures right now other than, I guess, posters and stuff at the airports. There's no screening done.
I will have to double check on that, but yeah.
Okay. I'm just so. The Minister of Foreign Affairs yesterday had said Canadians should be getting home via commercial means while they're still available. Do you know, I guess, a timeline or are you aware of any directive that international flights are not going to continue to come in?
That's at the federal level.
And for people, I guess, are there going to be, why have people quarantined at home or self-isolate at home? Like, are there going to be any areas, separate areas to be quarantined? Or is that not happening at this stage yet?
Well, certainly in any kind of pandemic planning, there are different types of measures necessary. So any discussions about that have taken place if that was necessary.
And for people who are self-isolating, who might be vulnerable and securely housed in a domestic violence situation, what should they be doing?
What was that question again? Sorry.
For people who have to self-isolate, who might be insecurely housed and be in a domestic violence situation, can't self-isolate at home for some reason, what should they be doing?
Certainly, my view on that would be they would be contacting the police authorities. They'd be contacting through 811 in terms of if they have the health condition, but that would become a domestic issue that would be dealt with public safety, and then we deal with whatever the requirement would be as we normally would in a domestic situation.
And just to clarify the number of cases, you said there's 4 presumptive. There was 1 confirmed. Was that second presumptive one confirmed as well?
Not yet.
So there are 5 presumptive and 1.
Correct.
Okay.
Correct.
Laura?
Could you elaborate on how these 4 new presumptive cases were identified? Did they come forward and present themselves as possibly having symptoms, or were they identified in self-tracing? I'm just wondering how that happened.
Well, for confidentiality reasons, I can't say all the details, but what I can say is that for that first travel-related case, those close contacts would have been identified at the time that the first case was identified, so they would have already been in contact with public health regularly as things evolved. That's what I can tell you.
Were these travel related? Did these people travel?
The 5 cases, separate from the first one, are close contacts of the person who traveled. Very, very close contacts.
And are we able to be more specific about the location? I notice this one, the zone is different than the previous cases.
Yeah, and I understand people want as much information as we can give them, absolutely. And I am giving all of that as we are able to, again, trying to protect people's confidentiality. It's really, really important that people understand the sensitivities around that.
I had some questions about testing. Do we have a number of how many tests have been done yet?
I think we're at 200, around 200.
And will you be opening up any testing sites?
Yeah, I just said that in my speech that the RHAs have testing sites that are going to be available by calling 811 if you have symptoms, and then you would be referred from that mechanism.
Savannah?
Ontario is reporting specific cities that cases appear in. Is there any thought of doing that as we get more cases, or are we just...
We can definitely consider that. Again, we are a small province, and we take confidentiality very seriously, so I will take that in consideration for sure.
How many testing units, I guess, are we opening, and when does that start?
Well, I've had conversations with the RHAs today, actually, around that, and my understanding is more information is coming tomorrow. So we'll give that to you when we have it.
Dernière question, Rose.
Dr. Russsell, qu'est-ce qui fait la différence du Nouveau-Brunswick dans toute cette épidémie-là? Est-ce que la population âgée, est-ce que le fait que c'est une plus petite province fait qu'il faut travailler, faire face à ce problème-là différemment? Est-ce qu'il y a des défis spécifiques à la province?
Absolument, absolument. C'est une très bonne question. Alors ici au Nouveau-Brunswick, c'est vrai, on a une population très âgée et on est une petite province. Alors ça veut dire que les ressources qu'on a au niveau des hôpitaux et des choses comme ça, c'est très important de protéger les plus vulnérables. Alors ceux qui sont plus âgés, c'est ça qu'il y a des directives pour ne pas visiter les plus âgés dans les centres de soins pour les âgés, pour les protéger. Alors, on prend ça au sérieux et on veut que le message soit que les gens doivent protéger les plus vulnérables. Alors, ça veut dire que ceux qui sont à la maison, on encourage de ne pas vraiment sortir beaucoup et recevoir des visites et aussi dans les centres de soins pour les aînés aussi de ne pas visiter.
And sorry, Mr. Premier, the second part, I guess, of one of my questions, I don't think you had addressed it, just the second part just about people who are housing insecure, where they should self-isolate.
Well, I think if they make their condition known to public safety, that they have that situation at home, that they aren't able to stay at home, then that would be dealt with by our enforcement officers. Yes, indeed. Yeah, I did want to comment in relation to the discussion with the Deputy Prime Minister Freeland. The discussion about the U.S. border and the discussion about the border crossing, because to your point of the foreign travelers coming in into our country, and at this point, you know, it's as Dr. Russsell states, it's purely a federal requirement for the Customs and Immigration to have that authority in question. And I understand that's not being done, but it was a question yesterday that I asked about because that is a genuine concern. And it is a federal requirement, or it would be a federal requirement should it be exercised. But the importance of getting alignment here, so I think was the stress point and saying, and I think we've seen a couple of provinces call for that. Premier Legault certainly did it yesterday morning. I've been discussing with Premier Moe as well about the same concern. So I think that's going to get attention. And when you talk about timing, I mean, the Deputy Prime Minister gave me every indication that they were working very closely together, and that message about bring citizens come on home. I think I would just say I think it's a prelude to let's start looking at how people get our citizens back into the country because there will be some changes coming. But she didn't say that. But I think we're kind of in a situation, and that's where the U.S. are. So the other point I just want to leave with here today. So coming out of this sort of conference or this session, is what can people listening here at home do? And I think we've indicated in a number of ways some things, but if there's one thing that someone takes away from this, it would be if you do not have symptoms, do not tie up our health system, because that is going to be the single biggest risk to us being able to get to people in a timely manner and isolate them from infecting someone else. So people really need to think about that. And when our call volume is 4 times a day what it should be, the citizen, we're not thinking about that as a group, and we must. So we can work through this, and we feel very good about the prospects of doing just that, but we cannot overload our system and miss the triggers that real people with a concern can't get access to.
Thank you, folks. Merci beaucoup.